Welcome to Clinical Capsules, your go-to podcast and trusted source for quick, evidence-based insights from TRC Healthcare. For 4 decades, we've been keeping healthcare professionals at the forefront of drug information and medical knowledge. And now we're bringing these vital clinical updates right to your ears, with new episodes every second and fourth Tuesday, delivering practical, actionable takeaways in bite-sized episodes. Today, Associate Editor and Clinical Pharmacist Don Weinberger explores how to avoid medication mishaps with pet prescriptions in an excerpt from our popular Pharmacy Essential Updates webinar series. Let's dig in.
And our article says, you're in a key spot to keep your furry patient safe when dispensing human meds for pets. And I'll try to keep the dog and cat puns to a minimum, but maybe a little rough. We're just going to focus on cats and dogs, and for any other animal, it's recommended to reach out to the veterinarian for guidance. Now, let's start us off with a patient case. Patient comes to your pharmacy with their service dog, a German Shepherd named Cupcake. Her dog has been having diarrhea lately, and she thinks it's due to a new brand of food she is using. The pet owner has used loperamide for herself for diarrhea in the past, and said it has worked great. She wants to try it for Cupcake's diarrhea situation and wants to know what you think. What should be told to the patient to treat Cupcake's diarrhea? We'll swing back to this towards the end of the webinar. Safety for all patients, including furry ones, is our main goal as pharmacy professionals. And while we try our best to prevent mishaps when dispensing meds, sometimes they do indeed slip through. In a recent case, a dog was given 5 times the intended dose of meloxicam suspension, since the dosing spoon used was calibrated for human consumption and not for pets. Unfortunately, the dog suffered a gastrointestinal bleed and needed emergency care. While stories like this are regrettable, use them to help ensure you're dispensing the right meds every time. Let's quickly go over some concerns with pet meds. As you know, there are many different species and sizes of pets, which can impact the safety and efficacy of when they take a medication. One example includes animals metabolize drugs differently than humans. Like, dogs can clear meds faster with their kidneys than humans, and cats have limited or deficient metabolic pathways used to eliminate drugs. Remember that human doses of medication often are not the same as pet doses. Let's take a look at a few examples now. We have a great chart on this that might help you follow along. Look for that link in the show notes. But I'll go through some of the highlights now. The vast majority of human meds used for pets are weight-based, and most are in kilograms per pound, but dimenhydrinate is in pounds. And some dosing will vary on whether the weight reaches a certain threshold or a specific species. With chlorpheniramine, a weight below 20 kilograms is a straight dose, but above 20 kilograms in body weight, it becomes a weight-based dose. And fexofenadine dosing in dogs is weight-based, but for cats is a straight dosing. Let's take a look at the other medications section. For levothyroxine, that the dose is 20 to 40 micrograms per kilogram, which is actually much higher than humans. This is because the drug is cleared from a dog's body much faster than a human. And for amlodipine, the dose for a cat is 0.25 to 1.25 milligrams per day, which tends to be much lower than humans. So, what should your patients consider before using human OTC medications and prescriptions for pets? Let's dive into some specific examples of this. Acetaminophen is contraindicated in cats because they can't metabolize it and could lead to toxicity. Acetaminophen can be used in dogs, but careful dosing, consideration of periodic lab monitoring with chronic use may be needed. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, may not be safe. For example, aspirin is metabolized fairly slowly in cats. It can accumulate and cause toxicity. And in dogs and cats, Even low doses of certain NSAIDs, like ibuprofen or naproxen, can lead to serious gastrointestinal bleeding and or kidney problems. Loperamide should not be used for some herding dog breeds. For example, like collies, Australian shepherds, Old English sheepdogs, and German shepherds, without genetic testing. These breeds may experience toxicity. Signs include excessive salivation, inability to stand or walk if they take loperamide. And loperamide in cats may cause hyperexcitement if they weren't excited enough already, and higher risks of colon impaction. Oral steroids like prednisone or prednisolone can be used in dogs, but prednisolone is preferred in cats. The reason why is because cats aren't able to convert prednisone to prednisolone, which is the active form. Let clients know about the acronym BEST to know when to call the vets. So have them watch for behavioral changes, eating less, skin redness or scabs, tarry stools, nausea or vomiting. These could be all signs that they're not taking the medication well and the vet should be called. Potential toxicity doesn't stop with active ingredients. Inactive ingredients also need to be on our radars when dispensing meds for pets. Reminder to point to product labels and package inserts to spot potential harmful ingredients. For example, animals are very susceptible to the effects of alcohol, which can lead to serious effects like dangerous drops in blood glucose, blood pressure, and body temperature if consumed by pets. Xylitol, also known as burnt sugar, is a common sugar substitute. Xylitol can be harmful to dogs by causing low blood sugar and liver failure. But keep in mind, xylitol does not seem to be dangerous for cats. Example of products that may contain xylitol include certain suspensions, some human meloxicam suspensions, liquids like gabapentin formulations, and some chewables. But keep in mind, other sugar alcohols like sorbitol is generally safe in dogs and cats, as long as it's not consumed in large amounts. Now that we're all pharmacology experts on pet meds, let's take a look at some best practices when dispensing prescriptions for pets. Follow your pharmacy's policy when setting up pet profiles. So examples include adding cat or dog to the patient's name, the species code, for example, like canine or feline, adding for veterinary use in the dosing instructions. Also verify you have selected the correct patient profile before entering RXs. Pets in their owner's profile usually will have the same last name, address, and phone number. Generally avoid dispensing pet RXs under the owner's name. This can lead to confusion or possible fraud if the RX is accidentally billed to the owner's insurance. Lastly, confirm medication histories. Some pet meds do slip into owner's list sometimes, and there has been cases where outpatient pet meds auto-populated the electronic med list of the pet owner when admitted to the hospital. Stay alert for potential red flags, since there has been cases that an owner may be misusing or diverting controlled substances prescribed for their pets. Examples include multiple veterinary prescribers, several pets getting controlled substances from different clinics, owners and pets prescribe the same controlled substance, early refills. Nothing you have to check manually for these, though, as some systems do not check for a refill too soon rejects on pet prescriptions. Also, keep in mind that you may be required to report controlled substance prescription dispensed to pets to prescription monitoring programs in your state or province. You can scope out some additional resources if needed when dispensing medications for pets, including information like uses, precautions, adverse effects, and interactions. For instance, Plum's veterinary drugs, the Merck Veterinary Manual, and Animal Poison Control Center all can help. And kind of keep that number in mind, that 888-426-4435. Just keep in mind that Animal Poison Control Center hotline may charge a consultation fee. You may want to consider keeping a list of local emergency animal clinics that are open after hours for referral to pet owners. Lastly, remember to provide administration devices designed just for animals. These include special dosing spoons or oral syringes, which usually come with the medication. Remember to dispense correct insulin syringes, since many penicillins are less concentrated than human insulin. And inhaler spacers, like AeroCat, are specifically designed for pets that make them handy when giving them an inhaler. Okay, let's go ahead and go back to our patient and her dog, Cupcake. Now that you're all experts, what should this pet owner know? So, as you learned, loperamide is toxic for herding breeds, like German Shepherds, and could be harmful to Cupcake. This patient should be referred to their vet for advice. Go ahead and dig into our clinical resource, Med Considerations for Cat and Dogs, for more dosing and dispensing tips to help keep pets safe.
We hope you enjoyed and gained practical insights from listening to this presentation. Be sure to follow or subscribe, rate, and review this show on your favorite podcast app, or find the show on YouTube by searching for TRC Healthcare or clicking the link in the show notes. While you're there, check out our other TRC podcasts like Medication Talk and Rumor vs. Truth. Also in the show notes, we've linked directly to a few of the excellent resources mentioned today, available to subscribers of Pharmacist Letter, Pharmacy Technician's Letter, or Prescriber Insights. On those websites, you'll also find a lot more evidence-based, concise, yet comprehensive resources on this and other medication therapy topics. And don't forget to check out our full Pharmacy Essential Updates webinar series for deeper dives into topics that matter to your practice. If you aren't already a subscriber, don't miss out on these resources. Sign up today to stay ahead with trusted insights and tools. We are an industry-leading, non-biased source of information and continuing education. As a listener to our show, you have access to a special 10% discount on a new subscription. Just use the code PODCAST1025 when you check out. And if you're a student, even better, students can access a free version of Pharmacist Letter. We've got links in the show notes that take you directly to the right places to take advantage of these awesome deals. Go check them out. You can find out more about all of our product offerings at trchealthcare.com. You can also reach out to provide feedback or make suggestions by emailing us at contactus@trchealthcare.com. Thanks for listening. Stay sharp, stay current, and we'll catch you next time on Clinical Capsules.